Footnote number 90. The old school physician gave himself very little trouble in this matter. In this mode of treatment, he would not listen to any minute detail of all the circumstances of his case by the patient. Indeed, he frequently cut him short in his relation of his sufferings in order that he might not be delayed in the rapid writing of his prescription, composed of a variety of ingredients unknown to him in their true effects. No allopathic physician, as has been said, sought to learn all the minute circumstances of the patient's case, and still less did he make a note in writing of them. On seeing the patient again several days afterwards, he recollected nothing concerning the few details he had heard at the first visit, having in the meantime seen so many other patients laboring under different affections. He had allowed everything to go in at one ear and out at the other. At subsequent visits, he only asked a few general questions, went through the ceremony of feelings, the pulse at the wrist, looked at the tongue, and at the same moment wrote another prescription on equally irrational principles, or ordered the first one to be continued in considerable quantities several times a day, and with a graceful bow he hurried off to the 50th or 60th patient he had to visit in this thoughtless way. In the course of that forenoon, the profession, which of all other requires actually the most reflection, a conscientious, careful examination of the state of each individual patient, and a special treatment founded thereon, was conducted in this manner by persons who called themselves physicians, rational practitioners. The result, as right naturally be expected, was almost invariably bad, and yet patient had to go to them for advice, partly because there were none better to be had, partly for fashion's sake. Explanation of footnote number 104. The old school physicians takes very little trouble in this matter. While doing case taking in his mode of treatment, he would not listen about the all circumstances of his case narrated by the patient, even for the minute. Instead, he will cut short the case, hearing especially about the sufferings of the patient, for not to delay in rapid writing the prescriptions, which is composed of variety of medicines which are unknown to him in their true effects. No allopathic physicians are interested to learn all the circumstances of the patient's case, and will not make the note in writing of it. In follow up, after several days, the physician will not be able to recollect about the details of all circumstances which he had heard during his first visit, because of so many patients were seen by him in between. He hears and ignores it without giving attention. At subsequent visits, he asks only a few general questions, examines the pulse at the wrist, looked at the tongue, and at the same moment wrote another prescription on equally irrational principles, or may order to continue the first one with considerable quantities several times a day, and gracefully goes to visit his next patient in such a thoughtless way. From all the profession require the most reflection, a conscientious, careful examination of the state of each individual patient, and to find a special treatment. If case taking conducted in this manner, haphazard way, by persons who called themselves physician, the rational practitioner, so whatever result are got from such a treatment was utmost bad invariably. Yet the patient were visiting them for advice, There were no option better than this, and partly for just formality or show off,